scientists, NGOs and policymakers in Durban at the 11th SA AIDS Conference to reignite a multi-stakeholder approach to fighting HIV. So for more of what we can expect on day 2 of the conference, let's cross now to SABC News reporter Minoshni Pillay. There she is. Minoshni, good morning. So let's talk about what happened on day 1 and then, of course, tell us what to expect today.
Sakina, good morning to you. Yes, day 1 yesterday opened with so much excitement and vigor. You know, it took me back to pre-COVID SA AIDS conference times. Last year, we know the conference happened in a hybrid format, and this is really the first full-on in-person return to SA AIDS discussions. And like you said in your introduction, scientists, civil society, NGOs, policymakers coming together now to say, where are we? Where are we with the status of 8 million South Africans living with HIV, 50,000 South Africans dying from the pandemic every year. And today the focus is shifting to key populations. These are people that have been identified as being at high risk of contracting the virus. And with me this morning, and to take us into that conversation about key populations, I've got Anele Yawa. He's the General Secretary of the Treatment Action Campaign, a key civil society movement that has been speaking this conversation with us from the very start of South Africa's AIDS fight. Anele, good morning and welcome to SABC News.
Good morning to you and the viewers at home.
Anele, let's just get straight to it then. Why do key populations still matter? Why are they still battling with access to healthcare services? We're here speaking about HIV/AIDS, but that's not really their only struggles, is it?
Yes, so key and vulnerable populations are at risk of contracting HIV, and if we do not pay attention to services that are meant for them, it therefore means as the country we won't be able to get to where we want to be. We have seen a number of facilities and in districts where we work in where key populations are still experiencing issues of stigma and discrimination, and ours is to stand up for the rights of all, irrespective of gender or sexual orientation. And where the rights of key and vulnerable populations are violated, it becomes our responsibility to stand up and fight for those rights, because if those rights are not protected and defended, it therefore means it will be a fallacy for us to talk about an end to AIDS. That's why as the country we need to pay more attention on issues that are related to services that are meant for key and vulnerable populations.
Anele, let's then get straight into the Richidze report released in November last year that looked at access to healthcare services at a community level. What were some of the key findings about this, just briefly?
So some of the key findings that came out is related to issues that talks to stigma and discrimination, where key and vulnerable populations are experiencing them when they go to health facilities. And this leads to some of the key populations to decide to disengage from care and decide to access those services in private sector where they have to spend money. Issues like people being ridiculed and humiliated because of their sexual orientation, where people are denied some of the services in our facilities, where we see in our communities that there are external pickup points, but they are not enough, where people have to travel long distance in order for them to access services in those external pickup points, as well as issues like some of the services that are meant for key and vulnerable populations, they put them at a position of being discriminated in facilities. So these are the things that we are saying we need to work together.
Anele Yawa, Secretary General of the Treatment Action Campaign, joining us this morning on SABC News. Critical issues, you know, close to a 30-year democracy, we still have challenges with these key populations and them being able to access equitable and equal healthcare services at a community level. And these are some of the discussions and you know, let's find solutions this week. We've got lots of role players here at the SA AIDS conference, and we will be bringing you those solutions of how more South Africans, the 2.2 million that are not able to access these critical HIV services, how we can get them to do that.